Thank you again for this opportunity to talk about Imdelltra, which is our DLL3 targeting bispecific T-cell engager, which was recently approved by the FDA for second-line extensive stage small cell lung cancer. Just to briefly go over what the approval was for, Imdelltra is indicated for the treatment of adult patients with extensive stage small cell lung cancer who've progressed or who've relapsed on platinum-based chemotherapy. As many of you know, when you're first diagnosed with extensive stage small cell lung cancer, the first types of treatments you get are a combination chemotherapy regimen with carboplatin or cisplatin, along with etoposide, or in addition to a PD-L1 inhibitor. So tarlatamab is specifically approved for patients who've progressed on that therapy, which typically we call second-line therapy. Now, I do have to remind everybody that the approval is based on an overall response rate, which is a measure that looks at how many patients had tumors that shrunk as part of the treatment, and also the duration of that response in those patients. Accelerated approval is a mechanism that the FDA has to allow drugs to be approved that meet a high unmet need in a difficult to treat population, that based on a different measure like overall response rates. Of course, we continue to study this drug and we'll continue to demonstrate verification and description of the clinical benefits in a confirmatory trial that's ongoing. As with many drugs, or as with all drugs, it's important also to review the important safety information. And there are two in particular I want to go through very quickly right now, and I'll go into a little bit more details around this. And these are both related to how Imdelltra works in activating the immune system to fight the cancer that it's targeting. And the two adverse events or side effects that I'll talk about is cytokine release syndrome, along with neurotoxicity and specifically immune effector cell-associated neurotoxicity syndrome. Otherwise, we call it ICANS for short. First, in terms of cytokine release syndrome or CRS, this happens when the immune system gets activated. And for tarlatamab or for Imdelltra, along with other therapies or treatments that have a similar mechanism that work this way in activating the immune system, these can occur in patients receiving treatment. And in some cases, it can become serious and sometimes life-threatening. Now, to help mitigate this, we initiate treatment with Imdelltra using a step-up dosing. And I'll go into a little more detail what this means. And this means starting with a lower dose and then going to the full dose in a subsequent dose. And this helps reduce the incidence and severity of the CRS. If someone does develop CRS while they're receiving Imdelltra, the recommendation is to discontinue it or hold it until it resolves. However, if it becomes very severe, then the recommendation is to discontinue it. The other safety event or side effect that I want to describe is called ICANS. And these can, again, also be serious and life-threatening. And this is also related to how Imdelltra works. And this is more in regards to a patient's mental, like headaches or other aspects like that. What we recommend is that when patients receive Imdelltra, that they're monitored for the signs and symptoms of ICANS or other neurotoxicity, and that you treat accordingly based on those side effects. Now, as I mentioned, I'm doing this on behalf of Amgen, and just to remind everybody, I do have to go through some disclosures, and this is in the way that we view it, a promotional program, and so it's been reviewed by our internal policies. It says I have been compensated for my time, but not in this case. Just to go through the presentation, go through what I'll talk about, share a little bit about Imdelltra and what it is and how it works. Then I'll go into the clinical trial results in terms of both the efficacy and how well it worked, and along with the safety. And then go into how do you think about managing some of these side effects that can occur when a patient is receiving Imdelltra. Next, I'll go into what a patient can expect regarding dosing and administration with Imdelltra. I'll talk through some of the additional considerations when thinking about Imdelltra, and then also go through patient resources that are available. And I think this is one of the things that Amgen really prides ourselves on, is that we're here to support the patients. So let's dive in and let's talk about Imdelltra as a drug. I think before we talk about Imdelltra, I think the one thing I do want to go through is small cell lung cancer. And I don't think I have to review with this group that it's a difficult disease. And so it's important that I think when you think about a treatment plan for small cell lung cancer, extensive stage small cell lung cancer, think about the entire diagnosis or entire treatment plan, the journey that you might be on as part of this. As you know, when you think about the different stages of how patients are diagnosed with small cell lung cancer, 2/3 are diagnosed with extensive stage disease. The other third are diagnosed with limited stage disease, meaning that their tumors are in a smaller part of their lungs. Unfortunately, the 5-year survival is too low. It's 7%, and something that I know at Amgen we're looking to help improve. And then also, once you start treatment, especially with extensive stage small cell lung cancer, unfortunately, more than 75% of patients typically will progress and will relapse after starting treatment. I already talked about the indication in regards to Imdelltra. And Imdelltra will come in 2 dosage forms, one at 1 milligram and one at 10 milligram. The 1 milligram is the lower dose that patients will receive first when they start Imdelltra, what we call the step-up dosing. This, again, is a way to help mitigate some of the side effects regarding CRS to help reduce the potential chance of that. Once you're past that 1 milligram step-up dose, patients will receive the 10 milligram every 2 weeks from then on. So how does Imdelltra work? So Imdelltra is what we like to think about as a matchmaker. And when you think about our immune system, we have cells within our immune system, T cells and other types of cells that go around searching for foreign bodies. So when someone has a virus or a cold, it's our immune system that recognizes it and then helps get rid of it from our bodies. Our immune system are also designed to look at foreign types of entity like cancer. And so typically, if everything is working right, our immune systems can recognize cancer and help get rid of it. But cancer actually tries to outsmart our immune system and start hiding from our immune system. So the immune system will no longer recognize it and recognize it as something that's foreign in the body. And that's how cancer begins to grow. And unfortunately, that's when cancer becomes diagnosed. Now, what Imdelltra does is actually it unmasks those cancer cells again. Small cell lung cancer cells express a protein called DLL3. And so because of that, Imdelltra allows our immune system now to recognize that cancer again. And because it recognizes it, it brings those 2 entities together, the cancer cell, the cancer, along with the immune system, and specifically here the T cells. And by bringing it together, it can target it, the immune system gets activated, and the T cell can then help attack the cancer cells by releasing different proteins that can help lyse it or to get rid of it. So Imdelltra, we think of it as a matchmaker that matches our immune system with the cancer cell. The reason why we target DLL3, and I mentioned this a little bit earlier, is because it's overexpressed or expressed in over 85 to 96% of patients with small cell lung cancer. And so because of how highly it's overexpressed, there is no biomarker testing required before you start treatment with Imdelltra, but allows us to really be very specific and target small cell lung cancer with Imdelltra. The other thing about DLL3 expression is also consistent across all stages of small cell lung cancer. So you will see it overexpressed or expressed in small cell lung cancer in patients who have limited stage, and different stages of extensive stage as well, depending on where you are getting treatment. Throughout this presentation, you'll see peppered in different safety information, again, as part of just wanting to share the safety of this drug. And again, I already talked about cytokine release syndrome, but to go into a little bit more detail, Imdelltra can cause cytokine release syndrome or CRS, as I mentioned. In our pool safety analysis, it occurred in 55% of patients who received Imdelltra, but most of it was actually in the lower grade 1 and 2. So when you think about these side effects, you think about it in severity. So grade 1 is the lowest severity and all the way to grade 4, which is the highest severity. For Imdelltra, most of the CRS events were in that grade 1 and grade 2 category at 34% for grade 1 and 19% for grade 2. And this is important because this actually results in how you think about managing it and treating it and what types of symptoms you might feel because of Imdelltra. Only 1.1% or 0.5% were grade 3 and grade 4. And so in terms of CRS, there is a risk of 55% of patients getting CRS, but most are grade 1 and grade 2. Now, once a patient has CRS, We also monitor whether they can get it again in the subsequent infusions of the drug. And so we know recurrent CRS occurred in 24% of patients of who actually initially got CRS, but majority of these were grade 1 at 18% and 6% at grade 2. The other thing about CRS is that we can generally predict when it's going to happen, because first, and in terms of when you're getting Imdelltra. So what we know is that most events of CRS will occur after the first dose, and most of these will occur in the second lead. So with 43% of those happening in the first dose and 29% of patients getting it in that second dose. After those first 2 doses, you only see 9% of patients getting CRS in the third dose or later. And I'll go into a little bit more detail about this later on, and what this means in terms of treatment and how we monitor patients who are receiving Imdelltra. The median time to onset of any CRS after receiving Imdelltra is 13.5 hours. And if for patients who got grade 2 or higher, the median time to onset of that was 14.6 months. So all within, usually within a 24-hour window. So what do you feel when you get CRS? You can have various different symptoms, but the hallmark of it is pyrexia or fever. So fever typically is the first thing that shows up. Another thing you can potentially experience or feel is hypotension, so low blood pressure, tiredness, higher heart rate, tachycardia, which is tachycardia, headaches, hypoxia, which is lower oxygen levels in your blood, or in some cases, nausea and vomiting. In terms of CRS, it can lead to potentially life-threatening complications if you don't treat it right or if you don't catch it early enough. And these could include cardiac dysfunction and all the other items listed there. And I'll go into a little bit more details about CRS in the subsequent slides. Now let's go into the clinical results. What was the data that helped get Imdelltra approved by the FDA? Now the study that was used to get approval from the FDA was our Imdelltra Delphi 301 study, which is a phase 2 open label, meaning that patients knew what they were getting. Also, the physicians knew what they were administering. A multi-center, multi-cohort clinical trial. And in this case, it was actually in third line plus extensive stage small cell lung cancer. 99 patients were enrolled in this or were studied as part of this study who received the 10 milligrams. And these patients had disease progression after the platinum-based chemotherapy, and actually at least in addition to that, and at least one other line of prior therapy. So these patients had received multiple lines of therapy before coming into this trial. Imdelltra was administered on day 1 as 1 milligrams, the step-up dose, and then the 10 milligrams, which is the usual dose, on days 8 and 15, and then every 2 weeks thereafter. And they received Imdelltra until they had progressed, or their disease had progressed, or the cancer had progressed, or they could no longer tolerate the drug because of safety. The primary outcome measure, so this is the measure that, as mentioned earlier, was overall response rate. So again, how many patients had shrinkage of their tumors greater than 30%. Other things that we looked at in this study was duration of that response. How long did that response last? Disease control rate. So these are patients who either had a response or had stable disease where their cancer stabilized, at least for a certain period. Progression-free survival, overall survival, and then we, of course, looked at safety during the treatment period. Now, how about the patients that are enrolled? And what we found in this study, again, is that these are your typical patients that you see in small cell lung cancer patients. Their age was consistent with that. Mostly were male. We also had most of the patients who had metastases at baseline. So over 97% patients had cancer that unfortunately spread to other places. 22% of patients had brain metastases, so cancer that spread into the brain, but they were under control. And you can see the different prior therapies that these patients had, whether it be platinum-based chemotherapy like carboplatin plus etoposide, whether it be topoisomerase 1 inhibitor therapy, which is like topotecan, or prior anti-PD-L1 therapy. So you can see that most patients had anti-PD-L1 therapy, which is now often used as part of your first-line treatment for extensive stage small cell lung cancer, and 22% had brain metastases. So what was our efficacy results? What type of benefits did we see in this trial in patients who use Imdelltra? So again, the primary endpoint was overall response rate. And what we found was that 40% of patients demonstrated response to Imdelltra, meaning that 40% of patients had shrinkage in their tumors by greater than 30%. Of these, 2% had a complete response, meaning that the tumors that were being measured all were no longer detectable, and 38% of patients had a partial response. The median time to these responses was 1.4 months. So patients were monitored every 6 months in this trial. And so most of these patients, when they first came in, after starting treatment, had reduction in their tumors if they showed a response. And 40% were still responding at 1 year when we cut the data, right? So many of the patients were still responding when we looked at analyzed the data. So when you look at the median duration of response, patients had a median duration of response of 9.7 months. And you can kind of see the range below that as well, from some patients responding, the lowest patient duration being 2.7, and some patients responding for over 20.7 months. What type of safety did we see in the trial? What type of side effects or adverse events did we see? Now, safety was evaluated in 187 patients with extensive stage small cell lung cancer. The reason why that number is different than what you saw earlier, the 99 patients that I shared about before, is because we combined two studies. One, the phase 2 study that I just described, along with the earlier study that we did that evaluated the 10 milligram dose. So here's a list of all the adverse events that you saw that happened in greater than 15% of patients. The most common one was CRS at 55%. But of those, the grade 3 or 4, which speaks to the severity, 1.6% of patients experienced a grade 3 or 4 CRS. Other types of adverse reactions that we saw in the study is fatigue, fever, which is pyrexia. Dysgeusia is that metallic taste that some patients get. Some had decreased appetite at 34%. Some experienced musculoskeletal pain. And you can kind of see the list there that in terms of the different effects that people experience. Now, those are all any grade. So any grade 1, 2, 3, and 4. If you look at the right-hand column, which is a grade 3 or 4, which talks to the severity of each one of these, you can see the percentages that are reflected there in the single digits in regards to the more severe grade 3 or 4 events. Now, how many patients actually had to discontinue treatment with Imdelltra because of these adverse reactions? And what you see is that 7% of patients discontinued because the adverse reactions became too severe. Some experienced dose interruptions, though, along that journey. Because of the dose adverse reaction, this means that they stopped one of their doses. The adverse events that required the dose interruptions or where they had to maybe pause the dose or pause the administration were fatigue, CRS, and respiratory tract infections. And those were all at 3.2%, 2.7%, and 2.1% respectively. Now let's maybe talk about CRS, because that is one of the more common ones, or the most common adverse event that you'll see. Again, as I mentioned earlier, when you think about CRS, we can generally predict when it's going to happen. And what you see here is a reflection of when CRS happened in relation to the dose of Imdelltra that they received. So most happen in that dose 1, the 1 milligram step-up dose, with 39%. Of those, the grade 3 or 4, 1% of those were grade 3 and 4, I should say. The second most frequent time that it happened was in that second dose at 28%. And then you can see the incidence or when the amount of CRS had happened in the subsequent doses, dose 3, 4, 5, and 6. And this will translate into how you think about monitoring patients who are receiving Imdelltra during those doses, which I'll get into a little bit later on. As I mentioned earlier, the median onset of any grade CRS was 13.5 months. And when a patient did experience CRS, it lasted for roughly 4 days. The other I mentioned is the neurotoxicities that's associated with these types of therapies, and typically regarding to ICANS, which is an immune effector cell associated neurotoxicity syndrome, again, related to how Imdelltra works. Neurotoxicity in general occurred in 47% of patients, and these are things like headaches, maybe a little bit of confusion, and things of that nature. Neuropathy, they occurred in 47%. 10% of those, 9% of those were related to ICANS, or specifically ICANS related to the immune mediated effects of Imdelltra. You can see when ICANS happened, this was a little bit different than CRS in the sense that it happened across maybe different doses that patients are receiving Imdelltra. They were all grades 1 and 2 if you look at in terms of the ICANS. And you can see 1% happened at dose 1, 2% happened at dose 2, and so on in dose 3 and dose 4 and dose 5. So when you think about onset and time of resolution of ICANS with Imdelltra, typically the median onset was 29.5 days after receiving their first dose of Imdelltra, and the median time to resolution was 33 days. So how do you think about managing this? And I'll go into a little bit more detail here. As I mentioned earlier, CRS can be manifested, so symptoms of CRS can be pyrexia, or otherwise known as headache or a fever, hypotension, low blood pressure, fatigue, tachycardia, headache, hypoxia, nausea, and vomiting. So these are sometimes the symptoms you might feel if you were to experience CRS. And typically these are progressive, meaning that they will start with fever, and they potentially, if it continues to get worse, then you'll see some of these other symptoms show up. And I do have to say they can be potentially life-threatening, although we didn't necessarily see high-grade CRS in our clinical trial for Imdelltra. So what are these grades? What are the ways that we measure the different grading of CRS? And this reflects the symptoms that you'll do, and then the types of ways that you might be able to treat it and manage it. So this is how we think about CRS in regards to grading and severity. The first one for grade 1, typically these are patients who have primarily fever of 100 degrees or more. And typically these patients are treated with Tylenol, things that help reduce fever in general. So as you remember, 33% of patients had grade 1. Of the 55% of patients who experience CRS, 33% of patients experience grade 1. Grade 2 is having that fever and hypotension or low blood pressure that is responsive to fluids. So hydration can help address the low blood pressure and help it resolve. Or they can also have hypoxia, meaning that maybe they have low oxygen levels in their blood, and that can be resolved with low flow nasal cannula, which is a way to help get more oxygen in the system. Grade 3, where we saw 1% of patients who in our trial that got grade 3 or higher. Again, very similarly, they will have fever and they will have lower blood pressure, but they require different drugs to help address it, drugs called vasopressors. They can also have worsening hypoxia, or they have lower oxygen levels that isn't responsive to low flow cannula, and they require more higher pressure oxygen to be put into to help them get oxygen into the system. And grade 4, which we did not see any in our trial, but we saw overall, you can see the different measures that are used here. Very similarly, high fever at over 100 degrees, and requiring multiple vasopressors to manage the hypotension and low blood pressure. And again, worsening hypoxia despite the other measures that you may have used for grade 2 or grade 3. So the key here is recognizing when you might first be experiencing CRS and speaking with your doctor about it, so you can help quickly address it with different drugs or different measures before it worsens. So I talked about the grades, and this now slides go into how do you monitor and how do you manage if someone does experience CRS. And I won't go into great detail here, but there are different measures that we provide in our prescribing information that help doctors manage their CRS event depending on the grade of that event. The other one is called, as I mentioned, is ICANS, and this can happen in patients who are receiving T-cell engaging therapies that work similarly to Imdelltra and including Imdelltra. And the way that this measures what type of grade of ICANS is actually based on a questionnaire where they ask you different questions, and depending on your score, it will determine what grade you are. So if you look at grade 1, if you're able to have a score of 7 or 9, and you're not, you're conscious and there isn't any depressed level of consciousness, that's considered grade 1. For grade 2, is having an I score, what we call an I score of 3 to 6. And I'll go into the questions that get asked as part of this. And maybe having a little bit lower consciousness, or you need someone to wake up, or a voice helps kind of get you focused. Grade 3 is a lower I score of 0 to 2, and then any other features that you see listed there. And then grade 4 is when, again, you have a I score of 0, and you're not necessarily be able to be woken up or by someone touching you or trying to wake you up. So how do you get that score is based on different questions. So they're in 5 different categories. One is orientation, where they ask you, hey, can you tell me what year, month, city, and hospital you are? If you answer all those questions correctly, you get 4 points. Another one is looking at name. If the doctor points to 3 different objects in the room, then you can and you can get them all right. You get 3 points. And you can see the other point scale there. And depending on what you score for all these questions determines your grade. Similar to CRS, we provide measures in our prescribing information for your doctors to know how should you treat if a patient does receive or get an ICANS, and you can kind of see the different measures there that can be used to treat this. A lot of, both for CRS and for neurotoxicities and ICANS, one of the key recommendations is that you hold Imdelltra until it resolves. The good news from our trials is that all patients who had Imdelltra and who had an ICANS event, it resolved based on some of the measures that you see here. Similarly, for CRS as well, that you see those symptoms or CRS resolve once you discontinue Imdelltra or hold Imdelltra, and then use some of the management strategies that were listed previously. There's also guidance in terms of different adverse events that can have happened when you're receiving, or a patient is receiving Imdelltra, like cytopenia, when it's like lower white blood cells, lower platelet counts, or lower red blood cells. That there's different ways you can manage those adverse events. Same thing with infections, hepatotoxicities, and any other adverse events that we provide guidance to doctor on how to manage those. This slide reflects what a doctor should do once you have one of these, when a patient has one of these events, and how you should restart dosing with Imdelltra depending on the event and the severity and how long since your last administration. So what can you expect if a patient goes in to receive Imdelltra? And this is the dosing schedule that is reflected here on this slide. And so as I mentioned, the first 2 doses, or first 3 doses of the first cycle, there are specific measures that we recommend in our prescribing information, both in terms of dose and the monitoring. And then in subsequent cycles, which is a measurement over one cycle is equivalent to 1 month, what you should expect in terms of observation and such. So if you look at the step-up dosing schedule, cycle 1, so the first month of treatment, on day 1, 8, and day 8, we recommend that patients receive dexamethasone or corticosteroid 1 hour prior to receiving Imdelltra to, again, help mitigate the chances of CRS and ICANS. In terms of the drug or the dose that you'll receive, again, it will be the 1 milligram dose as a step-up dose, and then 10 milligram subsequent doses. In addition, after getting Imdelltra, we recommend that patients be well hydrated, so that they also receive normal saline as part of that treatment. And the last piece is also important as well in terms of the monitoring. If you remember, most cases of CRS happen within 13 to 14 hours after receiving Imdelltra. So for the first 2 doses, day 1 and day 8, we recommend that patients be monitored in a facility a healthcare facility for 22 to 24 hours to make sure to monitor for signs of CRS and any other adverse events. Now on day 15, so the second week of the first cycle, patients we recommend be monitored for 6 to 8 hours post-infusion. The other thing I'll mention for day 1 and day 8 that's important to mention here is that in addition to being monitored in a healthcare setting, we recommend patients stay within an hour of an appropriate healthcare setting for a total of 48 hours from first getting Imdelltra. So even after they go home or go to a different, hotel or whatever it might be, if a patient recognizes a potential CRS symptom, that they can come in and get monitored appropriately or get seen by a doctor appropriately. For cycle 2, cycle 3, 4, and cycle 5, the monitoring recommendation reduces from 6 to 8 hours for cycle 2, 3 to 4 hours for cycle 3 and 4, and then for cycle 5 and up or more, observations recommended for 2 hours post-infusion. I talked a lot about neurotoxicity as well, but just as a reminder, this is a risk regarding Imdelltra and specifically around ICANS. ICANS specifically happen in 9% of patients who receive Imdelltra, with recurrent ICANS happening in 1.6%. Most patients experience ICANS following cycle 2, day 1, so a little bit later than CRS. And then these happen, the patients who had grade 2 or higher on day 1, day in, day 15 are reflected here at 0.5%, 0.5%, 3.7%. It is important to remember that ICANS can happen with CRS or after CRS or even in the absence of CRS. So it's just important to stay vigilant and monitor for any symptoms of this that you can talk to your doctor about. So how does Amgen support you? And again, I think Amgen prides ourselves on providing appropriate support for patients as they go through this treatment journey. And I just want to mention a few resources that are available for patients. Right from the get-go, we have one number that you can call that is staffed by our call center that can help support you set up, depending on what type of need or what type of support you may need from a patient perspective. Or you can also visit our website, amgensupportplus.com. And here, whether you're a healthcare provider or whether you're a patient, this call center, our Amgen representatives can help you navigate what type of support you may need. For the healthcare provider, for the doctor or the nurses that are helping patients receive Imdelltra, we provide support for patient benefit verification in terms of insurance, prior authorization, things of that nature. For the patient, we also provide an Amgen Patient Navigator. This will be a patient's single point of contact to help answer questions about the entire different aspects of treatment journey, whether it be reimbursement, insurance, how do you navigate the treatment logistics? As I mentioned, there are requirements for monitoring and such. So how do you navigate those pieces of it? Any other resources that you might need when you think about transition from hospital to outpatient care. So the Amgen Patient Navigator is your one-stop shop who will help answer questions that a patient may have along their journey. In addition, we provide, depending on the needs of the patient, we have resources available to provide financial support, both in terms of helping support for resources, whether you have private or commercial insurance, whether you have Medicare. Someone can help you in terms of understanding the drug costs, the reimbursement costs, and things of that nature. And then we also have a copay program that will help cover some of the out-of-pocket costs, but this is limited, or not limited, this is only for private or commercial insurance payers or patients who have private or commercial insurance to help lower their out-of-patient costs. Unfortunately, because of different laws, we can't provide this for Medicare patients or government-insured patients. Important safety information. I know I've talked about quite a bit of this already, so I'll skip through the cytokine release syndrome, the ICANS. We've covered this slide in terms of cytokine release syndrome and the risks associated along with the neurotoxicities. As I mentioned earlier, when we talk about management, there's risks for cytopenia or different levels like white blood cells, platelets, or red blood cells coming lower. Most of these were lower grade, but 6% of patients had grade 3 or 4 for neutropenia or neutrophils, which is white blood cells. There's a risk for infections, which is generally true for different drugs that leverage the immune system. Hepatotoxicity, so liver tests or liver enzymes can go up or down, or go up depending on how the patient is doing. And so it's important that patients be monitored for liver enzymes while they're receiving Imdelltra. There's also risks for hypersensitivity. It could be, a rash, maybe bronchospasm, depending on whether a patient is sensitive to Imdelltra or the different things that are part of the Imdelltra drug. And lastly, in terms of embryo-fetal toxicity, now based on the mechanism of action, Imdelltra can potentially cause harm to a patient who is pregnant. And so when we think about this, we make sure that we advise females of reproductive potential to use effective contraception during treatment with Imdelltra and for 2 months after the last dose. Here's a list of adverse events that we went through earlier today as well, just to go through it. The most common reactions that you can expect if you're receiving Imdelltra. This slide reflects the dosing and administration, what we went through again earlier in detail in the slide. The only thing I'll mention here is that Imdelltra is an IV infusion that's given over 1 hour, and that you'll do it in a setting where you're either at a hospital or a clinic that can help monitor for CRS for the first 2 doses. So in summary, we're excited about this therapy and what it can mean for patients. And Imdelltra is the first and only DLL3 targeted BiTE therapy for patients with extensive stage small cell lung cancer who've progressed on or after platinum-based chemotherapy. The way that it works, it leverages a patient's own immune system, specifically the T cells, to attack the DLL3 expressing cancer cells. Delphi 301 was a study that was used for approval and a registration with the FDA. And this was, again, in 99 patients with extensive stage small cell lung cancer who have progressed on multiple different therapies before receiving Imdelltra. The overall response rate was 40%. The duration of that response was 9.7%. And among those who responded, majority were in response or responded for greater than 6 months, and 40 were still responding at 1 year after starting Imdelltra. The safety and tolerability was evaluated in 187 patients with extensive stage small cell lung cancer. The most common adverse reactions that people experienced while they were receiving Imdelltra were CRS, fatigue, fever, the metallic taste in your mouth, a decreased appetite, musculoskeletal pain, constipation, anemia, and nausea. And because of how Imdelltra works, by using the immune system, it can be associated with immune-mediated adverse events or immune-mediated side effects, such as CRS and ICANS, which I reviewed earlier in the beginning of the presentation. In terms of how you receive Imdelltra, it should be administered in an appropriate healthcare setting as a 1 hour IV infusion every 2 weeks after the initial step-up dosing that I described earlier. And this will help reduce the incidence and severity of CRS in patients. So I'll stop there, and I just want to thank you again on behalf of Amgen for giving us the opportunity to share with you about our new drug.